Welcome to the Health Channel, all health all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios in Coral Gables. You know, before modern medicine, caring for someone medically in the home was quite common and hospitalization was rare. So today the goal is to reduce the number of hospital stays, and because of this, programs like Baptist Home Healthcare are really gaining popularity. Generally, family or friends play the role of caregiver, but home care allows patients to have a professional healthcare team at their fingertips, and in turn allows family and friends to remain just that. Not only that, but patients are offered telehealth, which is a fabulous, unique, tech-savvy way to get the best care in the most efficient way. And we're going to talk about that throughout the show. Joining us today to talk about all of this fantastic stuff is Tina Jacomino, Director of Home Care at Baptist Health South Florida. Welcome back.
Thank you. Welcome. Thank you, Olga.
Thanks for it. Really amazing how things have changed, right? Like
Yes.
Before, you know, it was like the opposite of what it is today.
Absolutely.
You know?
We have a lot of technology now to help us to deliver this care more efficiently, more effectively, and more access for patients.
That's right. And who doesn't want to stay home?
Exactly.
I mean, everybody always says, I don't want to go to the hospital. I want to stay home. Quiero estar en mi cama. I want to be with my family.
That's what we find.
Exactly. So you're filling in the blanks, which is fantastic. Okay, first let's talk about you a little bit. You're the Director of Home Care at Baptist Health South Florida. So what does that entail?
So primarily, I'm a nurse myself. I started off in the hospital as well. I worked at Baptist in the emergency room, and I've been in healthcare in the home care arena probably for about 9 to 10 years already. So I love it. My love for the community started once I started home care. I was able to really take care of my patients within the comfort of their home and find that really this is the area where you can spend the quality time and get to know them, get to know their family members, their dynamics, what's that all about? So as the administrator of Baptist Home Care, I oversee about 75 employees, and I have about 45 in the field. So between nurses, physical therapists, occupational therapists, and speech therapists, and home health aides.
All right. So a lot of people on the field that you oversee.
Yep.
So we're going to talk then about why are these people there, or why does someone need home health care? We have a graphic here to explain to our viewers a little bit about what it's about. So recovering from an illness, what kind of illnesses are common?
So a common illness would be an exacerbation of congestive heart failure. Perhaps a patient experienced a heart attack or a stroke. Perhaps they were going in to get a new pacemaker put in, or something as simple as a fall and perhaps a fracture.
All right, undergoing treatment like?
Undergoing treatment, it could be antibiotic for either a UTI, a urinary tract infection, or it could be wound care to a wound that needs pretty intense or skilled treatment, not your typical just slap on a Band-Aid. Post-surgical would be something like a fracture of a hip or a knee, anything of that nature. A pacemaker, again, as we mentioned earlier, and then education and training of a newly diagnosed disease process is really important, because a lot of times as we advance in age, we get new diseases or new comorbidities that we're faced with, and we don't really know how to deal with them. So perhaps if you were just diagnosed with congestive heart failure, you may not even understand what that is. And our nurses go in and they teach you about the disease. They give you signs and symptoms to look for, foods that you should be eating, how to take your medications appropriately, and things of that nature, which are very helpful.
Now, you said the program started in 2005. My question now is, how does Baptist Home Care different, let's say, from other home care options?
Okay, that's a great question. So there's over 400 different choices in Miami-Dade County. So it's a pretty saturated market. Where Baptist Home Care comes in as quality is you've come to love Baptist Health South Florida. So everybody knows the pineapple. We are, we're apart from the rest, right? We have, we're seamless in the sense that if you're hospitalized in one of the many Baptist Health hospitals, we have access to those records from the hospital. So our home care has a seamless transition from your hospital stay to the outpatient world. And that's key. That's very critical, because we know the surgery or we know the medications that the patient was taking while in the hospital stay. And we know the physicians that you have. So it's really a one-stop shop, if you will. We're also, apart from the rest, we hold a very high star rating. We're Joint Commission accredited. All of our staff is employed by Baptist Health, so they're not subcontracted, which is critical because they're all our vetted employees that have come to the same stringent analysis as all of our employees.
And you're the director.
And I'm the director.
There you go. And there's a big difference there because she's great at what she does. Do you miss nursing, by the way?
I do, but I feel that I still have an opportunity to do nursing. I speak to patients all the time.
Okay.
And as someone who gets to lead the pack, I feel that, you know, I'm able to still have a big role in it. I'm not the patient care nurse at the bedside.
But the knowledge is there.
But the knowledge is there, and I feel very closely with my staff, and I talk a lot with them and my patients, so I feel that I'm still very, very much involved.
So you're preaching exactly what you practiced before.
Correct.
There you go. A common misconception is that many people believe you actually have to be hospitalized to be covered for home care. But that's not true, right?
That's absolutely not true, and that's a great point as well to discuss. So if you're not feeling well, if perhaps, let's talk about that fall. Maybe you suffered a fall and you're having some difficulty ambulating, or maybe you now need to use a walker for safety. That would be a wonderful time to go and speak to your primary care to your primary care doctor and get an order for home care so that you can get physical therapy at home, or maybe, like we talked about, a new diagnosis that you're not really familiar with, or a new medication, and our nurses would go out and help you with that as well. So you do not need to be hospitalized.
Something that I think will happen a lot, and I saw it happen in our family, is when someone comes over your house, and, you know, let's be honest, it's a stranger, no matter how fully qualified, fantastic, wonderful, you know, just a wonderful resume. How do you make your patients feel comfortable knowing that, you know, this stranger is coming in?
Okay, that's a good one. So we always call the patient prior to going out there. We introduce ourselves. We let them know that we're coming from Baptist Home Care and that we're working in conjunction with your physician, so that you know we're just not showing up. When we do get to your house, all of our employees wear our badge, so it says Baptist Health on it, and it has their photograph. And I urge all patients to always ensure that when a member of the family of Baptist Home comes to your home, that you ensure that they are wearing that badge, because that is for your protection, that you know that it is a legitimate, qualified, either nurse or physical therapist from our organization coming to treat you. We make sure that we have all the information about you, so we're not going in blindly. As we mentioned before, we have access to your hospital records and your physician records about your care, so that we have all the information we need to know about you.
And if someone is just not happy with someone, can they switch if they want to?
Absolutely.
I think that's a fair point.
It is a fair point, and not everybody...
And it can happen. The chemistry's not there.
That's exactly what it is. There's a fine line, right, to everybody having that chemistry.
Right.
So, like I mentioned before, there's 45 different therapists and nurses in the office. We usually try and pair the right nurse with the right patient. For instance, if we have a mastectomy patient and it's a female, she's probably going to feel more comfortable with having a female nurse. We also have male nurses when we have a male wound care that maybe is in the growing area. And
language is important too.
That's very important,
right,
because we want you to feel comfortable. We know that this is your health care, and this is you feeling comfortable and having that close relationship with your healthcare professional is super important for your care.
And when that healthcare professional comes in, should somebody at home also be there with the patient, you know, like a second set of ears?
We encourage that. We think that having patient family-centered care is critical. We know that your family member is the one that's going to be there 24/7. Our nurses or our therapists will be in there to do that skill, to provide that teaching, to provide that education, but then we leave, and really the family member is the one that's there. So when all possible, we do encourage the family members to be there so that they're also listening to the teaching and the guidance that we're giving the patient.
All right, we're going to go through a list of ways that you, or types of home health care services that you can get. Skilled nursing,
Correct.
That we talked about. You have 40, what was it again?
Well, it's about 25. It's 45 total in the field.
Physical therapy, that's a big one.
Yes, very big.
Occupational therapy?
Occupational therapy. So that's really good for activities of daily living. So sometimes we've been in the hospital for a little bit and we're having difficulty just getting back into the swing of things, showering, eating, holding a cup, picking up the phone. So things of that nature, the occupational therapist will help you with.
All right. We also have social work services, home health aid, and telehome care. What's that?
So telecare is our telehealth program. We have some equipment that we'll show you a little later. And telehealth is known to transmit your vital signs, if you will, across a GPRS system to the office where there's a central station nurse reading your vital signs. It does things such as blood pressure, pulse, oxygen saturation, and weight. These things are very critical that we take them and we see what's going on with you so that if there's something going on with your vitals, we can identify them early on and we can intervene timely so that we can try and avoid another readmission. The goal here is to keep you home. That's where you really want to be. You want to be home, safe, in your home environment, and that's our goal. So telehealth helps us do that. And we're able to give that information to your physician so that they can intervene as well and help us with any medications that you might need, some adjustments or anything of that nature.
And we're going to show our viewers what that's all about in a little bit, and it's really interesting. It's actually fantastic. Quick question, when they do physical therapy, do these professionals bring like, I'm going to use the ball and the stretching bands, they bring it to you?
Yes, we do. We bring all of the equipment to the house that is needed, TheraBands and things of this nature. We even do heat pads or cold packs. Whatever we do, I want everyone to understand that this is with the overview of the physician. So our nurses or our physical therapists would never do anything with the patient without first discussing it with the physician and getting orders for that. So that's very important.
And you know what I like about it the most is, well, there's just so many reasons, but when you hear someone saying, oh, I have to go to therapy, you know, you have to get in the car, but they look forward to, you know, this professional coming to the house.
Absolutely.
There's a cafecito waiting for them, un pastelito de guayaba.
Which our folks love.
Stay for dinner. It's great, and becomes a family.
It absolutely does, and that's the point, right? To qualify for home care, you do need to be homebound, which means that it's a taxing effort for you to leave your home. So perhaps it's, you know, you're out of breath by the time you finish getting dressed, and you need the assistance of your daughter, your son, or your spouse just to get into the car. Maybe you need a walker. That is what qualifies you to be homebound. So having that physical therapist come to your home, or your speech therapist, or any one of our therapists or nurses is very comforting to you, because we can give you the care that you need within the comfort of your home.
And you can offer that little cafecito too, and they love you more.
Love the cafecito.
Coming up, we mentioned telehome care quite a few times, and when we come back, we're going to dive into what that is and how easy it is to use and what the point of it is. So a lot coming up. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Tina, please give us a call using the toll-free number 855-796-4475. Check out our website, allhealthtv.com. You can watch videos from previous episodes or submit questions for Tina. We'll be right back.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing.
And I sat in that waiting room talking to women, and there were about 10 of us, and I casually joked with another woman, I can't believe that 1 in 8 women will be diagnosed in breast cancer. There are 10 of us in this room today.
Yo sabía que iba a regresar positivo.
She was fairly certain that I had breast cancer.
When I heard my grandmother was sick, I knew I had to take care of her more.
I heard the 3 most horrific words anybody could ever hear. You have cancer.
They were giving me life-changing, devastating news, but at the same time, they were giving me a plan.
I felt very blessed to be here in Miami and to have a network of doctors.
Cancer treatment is ugly. The way Baptist treats you as a person is beautiful.
I just knew in my gut that I was going to be okay.
When you finish radiation, you ring a bell. Pretty much the entire staff of MCI showed up.
Your dream team is out there.
Las siento como unas personas como amigas, más que doctores.
If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go and see your doctor, get the mammogram, get checked.
I can't stress enough how important it is to be your own advocate.
Early detection saved my life.
So many people helped me, and now it's my turn to give back.
There's part of myself that I had lost, and I found it after.
Mis experiencias en Miami Cancer Institute han sido muy buenas. Los tratamientos han sido sensacionales.
Miami Cancer Institute is Disney for cancer patients.
Embrace tomorrow.
Programe su mamografía hoy.
Abraza el mañana.
Schedule your mammogram today.
Hurricane Florence made a direct hit on the Carolinas, causing wind damage and widespread flooding. As the floodwaters begin to recede, Allstate mobile claim centers are canvassing the Carolinas to assist people affected by the storm.
We have mobile claim centers set up throughout the entire area so that people can come to us and they can start the paperwork. And in some cases, if they have a covered loss, we can cut them a check on the spot or deposit money into their accounts.
Learn more at allstate.com/recovery.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Tina Jacomino, Director of Home Care at Baptist Health South Florida. If you have a question for Tina, please give us a call. There is the number. It's toll-free, 855-796-4475. We would love to hear from you. You know, a goal for people in the healthcare world is getting the best care in the most efficient way possible to the most people, of course. Telehealth, again, telehealth is a unique way Baptist Health South Florida tackles that by using technology to exchange medical information from one site to another. It's fascinating. Telehealth includes a variety of applications and services that can benefit patients, such as two-way video conferencing. You know, you get to talk and watch and look at the doctor and talk to them, monitoring vital signs and prescribing even medicine. So, Tina, tell us about this. I mean, it's really revolutionary, right?
It really is.
I mean, this is fantastic. How did this get started?
So this is a really innovative way of reaching to the masses. As you mentioned, everybody is looking for health care. And it's not that people don't want to access it, is that sometimes it's difficult to get there. So telehealth is a way that we're able to intervene with the patient timely and efficiently, and that we can get the information that we need from the patient. As you mentioned, Olga, there is many facets of this, right? So we have some equipment that will show you that is not the two-way virtual, but we also have iPads, and we also have a two-way video conferencing that is HIPAA compliant, and that you're able to see either the nurse or even the physician at times when it's needed to get that intervention, that face-to-face. You can even show them a wound care. Perhaps you were concerned about that. So there's many, many facets of it. Telehealth started many years ago. It's pretty new for some, but the reality is Baptist Health has been doing telehealth for very, very long, over a decade already. So it started off with the EICU, and the EICU really is what stemmed all these fascinating programs out into the community and the many different facets. We have telepsych, we have telestroke, we have teleNICU. So we've really grown exponentially in this department. And home care is in a place where, since we deal with the community, we're better than to access telehealth and to bring it out to the patients from this end of town.
Great stuff. Now, this hour, we're going to focus on the telehome and telepharmacy aspect of telehealth. But first, check out this video. It gives us a great overview of what telehealth really is.
In the skilled hands of Baptist Health South Florida's medical experts, telehealth is a game changer, empowering our physicians, nurses, and pharmacists in exciting new ways. Baptist's Telehealth Center is connected by two-way digital links between our hospitals, our medical teams, and our patients. Through a network of over 150 connected beds, our critical care patients are remotely monitored around the clock, providing an enhanced level of care to those most vulnerable. A physician, nurses, transport technicians, and secretaries staff this call center 24/7. Neurologists are linked to patients to perform virtual consults to speed up diagnosis and treatment of strokes. Passengers and crew members of cruise ships can access psychiatry services not previously available to them for crisis intervention. Private consultations in virtual rooms allow doctors to monitor their patients in between office appointments. Monitoring Baptist Health home care patients remotely allows telehealth nurses to identify negative trends and intervene early. Telepharmacists in the Tele-ICU can remotely provide personalized education to patients. In the hands of Baptist Health South Florida's team of qualified, compassionate caregivers, telehealth is expanding our ability to improve the health and well-being of the community we serve.
We actually had Gloria on the show. She was the pharmacist, and it was really great how she was talking. The doctor was in the car, just about to get in his car. It's just fantastic. Somebody on a cruise.
Exactly.
I mean, you can be in Egypt.
Anywhere.
And it's just great.
Anywhere.
And what I love the most about this is, once again, we talked about how everybody wants to be home. Nobody wants to have to go to the hospital. It really does prevent a lot of readmissions to the hospital, right?
Absolutely.
We have a graphic to show just how amazing this works when it comes to readmission rates. I know it's a little messy, it's kind of hard to see, but can you walk us through this quickly?
Absolutely. So these are patients, as you can see, on an average month, we have anywhere from 100 to 160 new patients every month. And the green little box on top is how many of those patients had telehealth. So you can see it's only 12.5% of the patients that come to home care actually say yes to telehealth. Remember, you have to consent to it. So not only does your physician agree, but the patient. And a lot of times patients don't know enough about it. Maybe they're scared. They don't really know what telehealth means. What do you mean equipment's coming to my home? What kind of equipment? What do I need? So we're here. The reason we're doing this segment is to ensure to you it's not scary, it's wonderful, and it's meant to help you and facilitate. You don't need any heavy equipment. We deliver it to your home. It's very small. You don't need to have a landline. We use this through GPRS, which basically what that means is it transmits through wavelengths, and the information gets transmitted to our office within 10 minutes. So from you taking your vital signs for the nurse to read it, it's as quickly as 10 minutes. So
you
again,
brought some equipment here.
I did bring some
So let's show that
equipment.
to our viewers. I mean, there's just so much more to offer, but here's a couple of things that we could fit on the table.
Exactly. So this is what the monitor looks like. You can see it's very little. It's about 2 sizes of my hand. It has a very easy yes and no buttons. So it's going to prompt you some survey questions. Things like, did you sleep with elevated pillows last night? Did you take your medication? Is there anything new? And every answer is a yes or a no. So it's very simple. Again, it not only do you read it when the screen is turned on, but it also talks to you. So if you're having difficulty, maybe you have low vision or difficulty seeing, it also, you could hear it. If you have difficulty hearing, there's also Braille. So we've basically covered every aspect, right? There's no reason why anybody wouldn't qualify or this would be helpful.
And it's also connected here.
It's
where
connected.
You can take your blood pressure.
Yep, I'm gonna turn it around for you. Again, let me remind you that our home health aide is the one that delivers this to your home, and they set this up. So it's not like it's gonna show up in a box and you're gonna have to unpack it and figure it out.
They get it ready for you.
We're gonna get it ready for you, but if something happens to slip off, right? Don't fear, because you can see everything is color coded. So for instance, here is the scale. And the scale has a yellow plug, and then the yellow goes to the yellow.
Oh, so very
it's pretty simple. Everything that we have, every peripheral has a color.
So these colors are for, let's say, one is blood pressure.
Correct.
Another one would be for...
Well, the other one is going to be for the pulse ox.
Okay.
Another one is going to be for the actual adapter, the AC adapter, so the plug, the outlet.
So it's tailored to you and your needs.
Absolutely.
Okay.
The cuff is going to go right here where it says really big cuff.
Okay.
Okay. Cuff. And that goes right here. Now, the other thing with the cuff is that we have 3 sizes, right? So not everybody is the same size cuff. We have a small cuff, a medium cuff, and a large cuff. And the aid comes out, we also know the weight of the patient before we get there, but we're always prepared, and we take extra cuffs with us to the home. So if, say, we try on the medium cuff and it's a little too snug, we'll swap it out for a large. We would never leave the home without ensuring that all the equipment works and it transmits to the office, and the nurse at the office contacts us and tells us, got all the vitals and everything's good.
So once they take the blood pressure, for example, obviously the machine reads it, sends it off to your, it looked like a war room. It was really cool, right? Headquarters. And if there's an alert, let's say it's I'm just going to use any number, 140/95.
Right,
then
we would
what?
get an alert. So the way that it works is we put in the American Heart Association parameters. So that's, and also your physician can tailor it. So if you tend to be someone that is running a little high or a little low and we need to alter it, we can. So it's not a one-stop or one-size-fits-all type of system, which I think is very nice. Because some of us have a very low blood pressure. So perhaps then you're always going to be under the American Heart Association parameter, but that's your normal. So that's something that we tailor in the system for you specifically. Your vital signs will be taken every morning. You'll put on this blood pressure cuff. It's very easy to put on. You can see it has Velcro. You can do it yourself, or your caregiver can help you. You'd stand on the scale. You'd put the pulse ox on your finger, and that's it. You don't have to push any other buttons. It's going to transmit, and it's going to get to the nurse in the office.
And any concern there that the nurse feels somebody needs to go out there, they'll head out to the house.
Absolutely, which is the beauty of having home care connected with a telehealth, because you still have the availability that if something is very wrong, we can send the nurse to your home. So it's not just electrical equipment with no actual touch, right? If it's necessary, the nurse in the office is going to contact you. She's going to walk you through how your vitals are doing. She's going to give you an opportunity to do some teaching, talk about nutrition, talk about your medication, remind you of your doctor's appointments, which is wonderful. Sometimes we have so many things that we have to remember. And as you know, when we're not feeling well, it becomes pretty burdensome that we have all these different doctor's appointments, and it's just a lot to take care of and to manage. So our nurse is there to help you with that phone call reminder and say, you know, you got to get ready because your appointment's in 2 hours and I want to ensure that you get there on time.
And let's talk about more benefits here, which is just a plethora. Let's show our viewers. It offers early detection and intervention, giving patients feelings of security, knowing that medical attention is closer to home, reports clear, concise, and accurate data in a timely manner, increases independence, which is what we want, reduces emergency room visits and hospitalization, enhances quality of life. I mean, it's just a win-win, isn't it?
It's a win-win. And you know that on that point with reducing emergency room visits and hospitalizations, I think gone are the times when we didn't feel well and we would just get in the car and go to the ER.
Right.
The ER is not meant to be a primary care office or a clinic where I don't feel well, let me show up at the ER. But I understand, right? When you're scared and when you're not feeling well, we panic. And that's what we've known is where we go to get our help. With telehealth, that nurse, you have that clinician available to you that's looking at how you're feeling. She's looking at not only your vital signs, but she's also asking you questions to kind of gauge where exactly this is going. And we can intervene so that you don't have to go and sit in an ER room and get admitted. You know, you can stay again at home and we're able to manage you, your symptoms.
All right, coming up, we're going to focus now on telepharmacy.
Yes.
Another great, we had Gloria.
Yes,
on
I love
last
her.
time. I love Gloria. She was on
fantastic.
our show. Yeah, if you go to the Health Channel and look up that
Gloria
show.
Kelly. And
Gloria
look at,
Kelly.
yeah.
Fantastic segment that we did on telepharmacy, but we're going to talk about it more now, so don't go away. It's a program that Baptist Home Care specializes in, where you can get a free consultation. Gosh, anything that's free is fantastic. A free consultation with a pharmacist by phone or a two-way video. We're going to hear from more about that when Tina comes back. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for Tina, call us using the toll-free number 855-796-4475, and there's our website, allhealthtv.com. We'll be right back.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right
that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Us lives here, where we can be surprised by others and ourselves. For a better us, support your local Y today.
Have you mixed your pain meds, your sleep meds, your allergy meds? Call the Poison Helpline. Has your child swallowed household cleaner, a chip of paint, a wild mushroom? Call the Poison Helpline. Have you been bitten by a spider, a snake, an insect? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first to speak with medical professionals who can give you free personal advice anytime. Save the number, save a life.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. If you're like me, you don't have time for flare-ups to slow you down. That's why I've taken the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Things like eating healthy, staying active, not smoking, and managing my stress keep me going. Visit simpletask.org to take the pledge to live well.
Migraines are pulsating headaches that often occur on one side of the head. If you suffer from migraines, you're familiar with the throbbing, one-sided pain that makes you sensitive to light and noise and causes nausea or vomiting. Some home remedies for migraine pain include changing your diet, monitoring triggers, scalp massages, using an ice pack, anti-inflammatory herbs like peppermint or chamomile, and staying hydrated. Contact your primary care physician about treatment options available to you today.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Tina Jacomino, and she is the Director of Home Care at Baptist Health South Florida. If you have a question for Tina, please give us a call using the toll-free number right there on your screen, 855-796-4475. We would love to hear from you. So under the umbrella, you know, because it's a huge umbrella of telehealth, is telepharmacy. We talked about it a little bit, and I've read that Baptist is the only home care agency in the nation that offers a free consultation with a pharmacist by phone or a two-way video call. So tell us a little bit about the purpose of telepharmacy, and then you guys are going to meet Gloria. You're going to love Gloria.
Yes. So the reason that we even started telepharmacy is that we understand that the _1 reason for readmissions is medication errors. What happens is patients have something called polypharmacy, meaning they have multiple physicians that address their needs. They could have a cardiologist, a primary care physician, perhaps an endocrinologist and a urologist, and they're all prescribing medications. And oftentimes they don't know what one or the other is prescribing. So there's duplication medications, perhaps there's omissions, there's drug-drug interactions, food-drug interactions. When a patient isn't feeling well and they end up in the hospital, a lot of times the hospitalist will also send them home with medications. And what happens is when the patient goes home, oftentimes they don't know what to do. Do they take the new medications that were just prescribed to them? Do they take the ones that they were taking in the past? Do they take them both? Do they not take any and wait for their follow-up appointment? All of these things can raise havoc and can make you potentially go back into the hospital. So because that's the #1 reason we felt that a telepharmacy program would be vital to your safety at home.
So let's meet pharmacist Gloria Kelly, who works with the Doctors of Baptist Health Hospital's ICUs to ensure patients are receiving the right medications and the right dosages. As part of the telehealth center, Gloria also works closely with patients of Baptist Health Home Care to review the medications they take at home. She is a sweetheart. Take a look.
Baptist Health pharmacist Gloria Kelly doesn't work in a pharmacy surrounded by medications, nor does she see her patients in person. Ms. Kelly works in Baptist Health's telehealth center, electronically connecting to her pharmacy patients.
As an e-pharmacist, I monitor all of the patients in the ICU within our health system, as well as monitoring those patients within the home health care. And what I'm looking for are drug interactions, drug duplications. I'm also looking for the appropriate doses of their medication.
The patients she sees are like 51-year-old Marcial Garcia, who had a heart condition that landed him in the hospital.
That afternoon, I went to the hospital because I was having a chest pain. They did surgery to open my blood vessels.
Mr. Garcia was sent home from the hospital on at least 7 medications. One, a blood thinner, carries risks that Baptist Health Home Care nurse Virginia Lally wanted him to understand. So she initiated an electronic consultation between Mr. Garcia and Ms. Kelly.
I felt it was important for Gloria to meet with Mr. Garcia because he's on Jantoven and it has a risk for bleeding.
So when you go to a pharmacy and you have a headache or a stomach ache, you need to look at the bottle and see if it contains aspirin. What I have provided is a list to Jenny, and Jenny will give you that list, which contains all of the drugs.
Gloria teach me today that I have to be careful of all the medication that I got from the pharmacy.
And Ms. Kelly also works closely with the doctors who prescribe the medications to ensure the patient is getting the proper dosage.
Well, I've caught patients on multiple medications, patients taking too little of the medication or the doses being too high, or medications that were just omitted from the patient's profile.
As for Mr. Garcia, he was happy to have connected with Ms. Kelly to learn about his medicine.
I like to see Gloria on the computer screen because she helped me and I feel very comfortable.
What a great service. And let's see who benefits from it. And we have a list to show you. You know, patients with multiple conditions. That's very important, Tina. Absolutely. Patients with recent hospitalization, patients with a recent fall, a team of multidisciplinary physicians. I mean, it's just so many facets.
Absolutely. And it's been a wonderful program. The patients have really enjoyed it. They're learning something new all the time. So I encourage everyone to try this. Again, it's free.
Which is always fantastic. Yes. F-R-E-E. It's all done via the iPad, right? And I know you brought one to show us. Tell me how it works. We actually, I think, have some photos of what a patient would be seeing.
Yes, so here's the iPad. We can do it 2 ways. Okay. Our physicians, or our nurses actually take to the patient's home the iPad if that's what they're interested in, or they can do this also on the phone. So here, all they would do is they would click this button. It's pretty simple. They would sit join conference, and then right here. And then what's gonna happen next is it's just gonna be a 2-way video. You're gonna see pop up the camera, and I think we have a screenshot of it. We're gonna see yourself, and we're gonna see the pharmacist on the other end, which I think in the video you just watched, you saw clearly what the pharmacist, it's a very clear picture. And this offers the opportunity for Gloria Kelly, the pharmacist, to actually see the patient's face while you're talking, and you can see her. So it makes it a lot more personable. She already has the list of all the medications the patient is taking because, again, as a home care recipient, our nurse would have written down all the medications, doses, frequency, names, and we put them in our electronic medical record that Gloria has access to. So by the time that this call is being done with you, the patient, she already has reviewed all your medications, and that way that time is not wasted on fumbling through. She already has a clear picture of everything you take and can get right down to telling you what they're for and answering any questions that you may have.
Fantastic. Speaking of phone, on the phone today we have Mr. Mills Goodman. He's actually a telehealth patient. And Mr. Goodman, I should say, are you there?
Yes, I'm here.
Thank you so much for calling into the Health Channel. We do appreciate it. I have Tina with me.
Hi, good morning, Mr. Goodman.
Good morning.
So let's talk a little bit about you. Would you mind if we asked how old you are, Mr. Goodman?
Well, I'm 81. I'll be 82 on Friday, October 5th.
Oh, well, happy birthday.
Happy birthday, yes. Feliz cumpleaños, as we say in Spanish. So how did you qualify for the home care program? Can you tell us your story?
Yes, I was a patient at Baptist Hospital, and they did surgery on my heart. And when they sent me home, they told me that I would have a nurse from telehealth would come out and explain everything to me about the medications that I was taking, the reasons why. If I had any kind of complication, they would be there to monitor. Mm-hmm. And they gave me a home monitor that I would turn on every morning, to take my blood pressure.
Fantastic.
And would take my...
And how was that service? How did you feel about it, having somebody? Tina and I were talking about how the fact that most patients, really don't want to leave their home. How was that service for you? Were they coming to your home? Obviously beneficial, sir?
Yes, it was.
Why so?
Because I didn't have to. For one reason, I don't drive anymore, and my daughter and my granddaughter, they work, so that was really convenient for me. I didn't have to leave the house.
Isn't that fantastic, Tina?
That's wonderful. And Mr. Goodman, you were able to speak with Jackie, the telehealth nurse, pretty often, right? Almost daily, to talk about your vital signs, and she helped you with your medications and give you the education you needed. Did you feel that that was helpful?
Oh, yes.
Wonderful.
But sometimes when I didn't know that I had to wait for my heart rate to be a certain level before I took certain medications. So like some medicine I was taking, my heart rate had to be 50 or more before
correct.
I took the medicine. If not, then sometime she would ask me how I was feeling, and if my breath was short, or if I had pain in my chest. But then there was a nurse that came out twice a week, and she checked me, and she came there really to, before I spoke with Jackie, she came out to explain everything about telecare, telehealth, and explain about my medication, what it was for, and how I should take them.
Excellent. And how are you feeling today, Mr. Goodman?
Oh, I'm feeling good.
Awesome. That's what we want to know.
Sound fantastic. We talked, Mr. Goodman, about having that relationship with that person, that chemistry. Did you feel good every time she came over, like someone there cares, takes the time to go to you?
Oh yes, she was a sweet lady. I think her name was Ann, and she was around. She was an elderly lady. She'd been nursing for a long time, and she was real pleasant.
Any advice, sweetheart? Oops. I'm sorry.
Yes, and
any advice you would have for others who need maybe this home care and are having second thoughts? What advice would you give them, sir?
I didn't understand you. I didn't hear you. I'm kind of hard of hearing.
Oh, no worries, please. Any advice that you would give others that maybe haven't tried this service?
Oh, I tell them definitely to accept it and try it because it's really helpful, especially if you really don't know about your medications and how they might change and what reaction you might have to them.
Excellent. Well, we thank you, Mr. Goodman. That was wonderful, and we're so happy that you're doing better. That's our goal. So we're happy that we were able to assist you, and you know that you can always contact us at any time to help you with anything you may need.
Thank you.
Thank you. And again, this Friday, a very, very happy birthday to you.
Absolutely.
Thank you.
All right. Thank you, sweetheart, for calling in. Do appreciate it. Great, even from hearing it from you, but hearing it from someone who's benefited from it. All fantastic. All right, so we've got one more segment. Our time is almost running up. So what's coming up? We've been discussing Baptist Home Care, which we've mentioned is short-term care, but at what point might you consider it long-term care? That's something that we need to discuss. So don't go away. You're watching the Health Channel, All Health All the Time. We've got a number there for you to call in if you'd like to give us a call. 855-796-4475, or just visit our website right there, allhealthtv.com, and we'll be right back.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Tina Jacomino, Director of Home Care at Baptist Health South Florida. If you have a question for Tina, please give us a call using this toll-free number. It is 855-796-4475. So we've talked a lot about home health care, Baptist home health care, I should say. Yes. Very important to put in that Baptist. It's not long term. This program, Tina, I want to ask you, it goes from 6 to 12 visits. How do you determine the amount of visits that a patient receives?
Okay, well, it's very individualized. So it could be 2 visits, and it could be 60 visits, right? So every patient is going to be treated as an individual, as it should be. It's not a cookie cutter. It's not out of the box. So if perhaps you needed to have an IV for 30 days and there was no one at home that we could teach to administer that IV, then our nurses would go out for those 30 days. So everybody's different. Some patients just need that little bit of that education and a little bit of guidance at the very beginning because it's new to them, and we're there maybe 2 or 3 visits. But to answer your question, 6 to 12 is just what when we analyze all of the patients that we've seen throughout the year, I mean, on the average, it would be the average. Right. But everybody's different. So I currently have some patients that we've even what we call a recertification, meaning that they get a second 60 days.
Okay.
But it's not intended to be chronic, I guess is really how we would address that question.
Which is long-term.
Is long-term. This is an acute episode. So like a diabetic would be a perfect example. Diabetes is going to be with you forever. So that's something that's chronic. How home care can help you is if you are newly diagnosed with diabetes. So we would go in and we would teach you what the side effects are in hypoglycemia and hyperglycemia, where to store your insulin, how to actually inject it. We would go through the rotation sites. A lot of information that's very critical to your success with living a quality life with diabetes. But after a certain amount of time, once you were fully educated and knew how to treat it, then we would discharge you and you would be on your own. So that's the difference. That's what home care is intended to do.
Now, my question is, once the visits are over, and obviously, like you said, it's not chronic, it's not long-term, how does Baptist Home Care help then prepare family who now becomes the caregiver again? I mean, they never were not the caregiver.
Absolutely, they were always involved.
Always, but now
they're on their own.
Exactly.
Okay.
How do you get that family ready?
Perfect. So once the patient is discharged, and I would say primarily most of the patients, when they're discharged, they're safe to stay in the community and they're good. But if, let's say, the level of care is advancing, so home care isn't the appropriate post-acute care anymore. Now they need to go a little bit further. Perhaps it's hospice, or perhaps it's an ALF, or perhaps it's a skilled nursing facility. That would be care that's provided around the clock. So 24-hour care. Typically, this happens when the patient leaves their home and goes into some sort of facility because perhaps they don't have the means at home. Maybe their family works and they're not home and they do need that assistance around the clock. What we do is we help the family and the patient make those decisions. So we'll give them resources. We'll provide them with phone numbers, and we'll provide them with information on home rehab centers or skilled nursing facilities that are in their area. Perhaps if the patient is very religious, they may want a skilled nursing facility or a rehab center that caters to that type of person, that has masses on a daily basis and things of that nature, which is sometimes pretty important,
exactly,
right?
Absolutely.
Maybe English speaking facility versus a Hispanic facility. So we try and help the family with these types of resources.
And it's good to help because it could be so hard having a safety conversation with someone who is elderly. Primary care physician Dr. Manuel Torres says that it's not about taking away their independence, but rather just being worried about their safety. Let's take a look.
The safety conversation is one that has to be held with parents. I'm at the stage where I'm going to have to have that as well with mine.
Sure.
How do you start the conversation when many of our parents, they don't want to hear it?
Correct.
They're fine, leave me alone, and stop dealing with me.
Well, it's interesting because safety and the safety conversation may actually be an opportunity to review and discuss their situation, their future. And it's important that we try to approach that safety conversation for exactly what it is. It's a safety conversation. This isn't, I'm going to come and steal your independence. This is, I'm worried about your independence, and is your independence potentially putting you in danger? And that's the connection that we want to try to help our patients make and maybe help your parents make.
I know you wanted to chime in a little bit about that safety.
Absolutely. So our nurses, when they're out in the home, and our physical therapists, they're looking at the environment, and they're seeing that maybe this isn't a safe location anymore for the patient. Maybe we want to have the conversation with the family and tell them, you know, I think that your family member is advancing to the point that it's unsafe for them to be home by themselves when you're not here. There's a lot of trip hazards. We don't want them to perhaps turn on the stove and create a fire because they're forgetful. So it's not, again, that we're trying to take away their independence, but their safety is key for all of us.
Any last-minute thoughts, advice for someone who's never maybe taken advantage of this Baptist home healthcare?
Absolutely. I think that patients really would find the benefit when we go out to their homes just to understand and really get a good understanding of their medication, of their disease process, of what's happening. We're only there to ensure your safety and to make sure that you're on your way to health and to stay home and independent. So I would strongly urge anyone that is not feeling well or has any changes in health to seek the care of a home health care, Baptist home care, where you know that you'll be well taken care of, and we're here to provide you with all of the needs that you're going to need to stay home safely.
And I can see that it's just formed such a great relationship. It's a team effort. I'm sure when the visits are over, they're like, no, don't leave.
Absolutely.
Don't leave.
Sometimes they were skeptical or unsure of
And
what
now
this
they're
is
like,
going to be about. And then it's like, no, I'm not ready for you to discharge me.
Oh, thank you so much,
Thank
Tina.
you, Olga.
Truly a pleasure to have you.
Thank you.
And thank you for all you do. Be sure to join us next time on the Health Channel, All Health All the Time on South Florida PBS. Follow us on Facebook and Twitter at All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, to submit questions for Tina or other doctors and watch videos from previous episodes. I'm Olga Villaverde. We hope you enjoyed today's show, and we'll see you next time. Take care.